while a few more people might join in, I will just at least start with introductions, and then that way, Mikki, you can start with sharing your story soon. Sorry, just getting another note about that. Okay, so welcome everyone, and thank you for joining another alumni office hour. For those of you who this is your first time attending, thank you for joining us. And I'd like to take a moment to acknowledge that much of the work of the University of Waterloo takes place on the traditional territory of the neutral Anishinaabe and Haudenosaunee peoples. Our main campus is situated on the Haldeman Tract, the land granted to the Six Nations that includes 6 miles on each side of the Grand River. Our active work toward reconciliation takes place across our campuses through research, learning, teaching, and community building, and is centralized within our Indigenous Relations Office on campus if you're looking for more information or more learning for yourself. I'd like to welcome everyone again. My name is Jen Bentley. I'm the Alumni Advancement Officer in the Faculty of Health, and like to thank Mikki for joining us today. We have Mikki Campbell here. She graduated from the Masters of Health Evaluation from Waterloo, and is here to share her story and journey through her career with you. And this is just one initiative that we have created to bring alumni back to connect with our students, as it is an important priority for both the faculty and the broader university. It's great for us to have alumni to help show our students what's possible. The success that they've had and the stories they share help to show students what's possible for their own futures. So if this is your first time joining an alumni office hour event, welcome. We have more scheduled for the month of March as well, so please take a look at the schedules of what's coming up, and we will be continuing to host these sessions every term, so that we're always providing an opportunity for you to learn about new careers and just get great information from our amazing alumni. So we do hope that this will be a really engaging conversation. So after Mikki's presentation, she's going to share her story with you first. Then I will invite everyone to turn on their cameras, and we'll have a live Q&A discussion. People can use the raise hand features to ask questions and talk face to face, screen to screen with Mikki, and we'll pull all of the great knowledge and information out of her to share with everyone here today. So I will give a quick introduction of Mikki. So Mikki has a master's in health evaluation from Waterloo and currently serves as the manager of strategic initiatives at the University of Toronto affiliated Sunnybrook Odette Cancer Centre. Her portfolio encompasses the research, implementation, and evaluation of novel radiation medicine technologies and the development, delivery, and evaluation of interprofessional continuing education within the cancer ablation therapy program. And I will leave it at that and let Mikki tell you the rest of the story. So thank you for being here with us, and over to you.
Thank you so much, Jen, and thank you to everyone this afternoon for joining. I have been very much looking forward to this conversation, and like Jen mentioned, it will be very conversational. So with the help of Jen, we'll watch for raised hands, we'll watch for activity in the chat. But to get us started, I'm going to share screen here just to give you a bit of an inside look into my journey, which is very much based on leading from heart and purpose with grit. So we're going to get a little vulnerable today, and I'm going to share some things that I'm just recently starting to realize and appreciate, sharing these stories to support people through their journey, and for myself to learn more to continue on with my journey, both personally and professionally. So I'm going to start off at a very young age. if my computer will let me go to the next slide, because I really, upon reflection, believe that our experience shapes our lives. And there is a unique point in time where you reflect on those sliding door moments. And I recently reviewed what is a sliding door moment as I continue to hear this come up. It is a term popularized in the late 20th century, meaning those seemingly inconsequential moments that alter your future events' trajectories. So I'm hoping that as we go through my journey and as we go have our dive into deeper conversations, that you also take a moment to reflect on how your life experiences are shaping your journey personally and professionally, and what may be those sliding door moments for you through your journey. So I'm going to start off around the age of 7. My family. You can see my younger sister, we're 3 years apart, fishing, we're doing the Disney World, my mom and my dad. And then, you know, everything, I was baseball, I was Ghostbusters, I was Teenage Mutant Ninja Turtles, the real, you know, born in 85, things that I loved. Then in 1992, my father was diagnosed with a brain tumor. And following that, he passed away. So passed away in November for a 6-month battle with a brain tumor. And through that journey, what we went through, at that time we were up in Sudbury, and my family had to travel. So my mom and dad with 2 young children had to travel to Ottawa at the time because there was no MRI in Sudbury. So having to find care for my sister and I, they flew to Ottawa to get a necessity MR imaging to determine what type of treatment he would be able to have. And so it was a challenge, and he was very anxious. And I remember as a 7-year-old hearing stories about when he was going through radiation treatment. I think you'll probably start to connect the stories with my biography. There was one in particular, a radiation therapist from Australia, that would have a story prepared for him every time he entered the treatment room, so that it would be able to get him through his treatment. And it was just that amount of connection with that treatment team where he was able to get through a very difficult treatment knowing his prognosis. So as we were going through, realizing we don't have access in Sudbury to state-of-the-art care, my family took the time to petition and advocate to bring an MRI to Sudbury so that families such as ours could have access closer to home. And that at the age of 7, if we think back to our lived experiences, really shaped how my future went from there. So at the age of 7, I knew I wanted to be a radiation therapist. That unique relationship that my father was able to build with his radiation therapist each day over 6 weeks delivering treatments meant so much to him and so much to my family that at the age of 7, I knew radiation therapy, radiation oncology was going to be a goal of mine. So we're going to fast forward a bit and what I learned is radiation therapy was a second discipline degree. So what that means is you have to have 1 or 2 years of an undergrad before you even apply to medical radiation sciences. So I started my undergrad at Waterloo and then transferred into medical radiation sciences at University of Toronto. And at that point, really wanting to figure out how do I get more involved and learn more about radiation oncology through summer jobs, through volunteer, whatever it could be. So I, as a very curious mind, lifelong learner, was looking at organizations through Google searches at this point to figure out, based on my lived experiences and what my passion is in terms of ensuring access to care closer to home, I came across Pogo, the Pediatric Oncology Group of Ontario. And I'm going to pause and say, this was a sliding door moment for me, because at that point, this was probably in 2006, 2007, I picked up the phone and called Pogo and was wondering what the volunteer opportunities were or summer student opportunities were. And I was connected with their director of research at that point and was able, this individual who still remains a lifelong mentor to this day for me, provided all the different opportunities. Here's what volunteer looks like. Here's what student placement looks like. And I said, yes, want it all. So I, at that point, based on a decision to pick up the phone and call an organization that aligned with my purpose, moved forward and spent many years with Pogo throughout my medical radiation sciences degree. And Pogo is a provincial organization. So if you take a look at this slide, they have over 250 stakeholders. They engage with over 20 hospitals across the province. And the way that they engage with those hospitals are really across the spectrum of cancer care. So they are doing research, they're doing access to care, they are engaged with patients and survivors. So it really is across the spectrum, all the opportunities that Pogo provides to healthcare professionals, to patients, to their families, to survivors, even post-treatment. And at that point, I was going through to become a radiation therapist. So my mind is curious, and you're now in a room listening and learning about all the opportunities and all the initiatives going across pediatric oncology at that time. And there was another decision. So as I was kind of moving from student to research assistant through to manager of their strategic initiatives, I came across doing their 5-year glance at how we were doing with the strategic plan. And I'm seeing things like proton beam radiation therapy, CT PET scans coming down the line. So really emerging technologies and trends that will impact the care that we provide. And there was a chair, a physician from Princess Margaret Hospital that I was co-leading initiatives with. And I took a moment to write down what my goals were at that time and to actually ask for a meeting to share with him what my goals were in terms of doing research within the central nervous system, so brain and spine, to be able to be involved in not only implementing, but evaluating novel radiation medicine technologies to ensure that families have access to care closer to home. And at that point, he had no idea until I actually took the time to share with him my goals and said, Mikki, I have an actual radiation therapist or radiation oncologist, physician, who is just starting his career also in central nervous system, so brain and spine tumors. I think you should meet him. It ended up being a walk down a hallway, introductions face to face, and the gentleman, again, another individual who is still a lifelong mentor for me, said, "Do you want to go for coffee?" So sliding door moment, I say, sure, absolutely, I'll go for coffee with you. And throughout that coffee, I learned about all of his research and the developments that he's doing for both spine and brain cancers. And he says, I need a research coordinator to manage all the studies going on. Are you interested? First time meeting the gentleman, having coffee, again, have to make a decision. And I say, yes, absolutely. Again, aligns very much with my goals and my purpose. So start to continue to do my radiation therapy degree. And at that point, doing research and working with Pogo. So then we come to 2014 when I graduate and achieve a personal and professional goal to become a radiation therapist. So now I'm continuing with my research, but now I'm also adding that clinical experience. So before, when I was sitting in these meetings at Pogo, I was listening and I was learning, but I was really never able to engage in the conversations, because I didn't have that clinical experience or that knowledge or that engagement with patients and families. I just had my own learnings. So now I'm on the treatment floor and I am delivering treatment, engaging with patients, families. And what happens is, through my research and my clinical experience, I continue to share my goals to be able to ensure access to state-of-the-art technologies for families. And with sharing that information, the Cancer Ablation Therapy Program is brought to my attention. So what this program is the first in Canada, whereby we are doing the research, development, and clinical implementation of 3 state-of-the-art radiation technologies. So based on my experience with Pogo and strategic planning, with my clinical experience now as a radiation therapist, with my research experience now within the central nervous system, the team comes to me and says, would you be interested in being a manager of the Cancer Ablation Therapy Program? So you pause again and you think, very much aligns with my purpose, able to really drive the fact that one of the technologies, I'm going to take a moment here, one of the technologies actually takes a linear accelerator that delivers the radiation therapy treatment and combines it with an MRI. So now I'm thinking, oh, you mean the MRI that my family couldn't access? Now we're actually combining 2 technologies to ensure that not only our patients can have the imaging they need, but they have it right before the treatment is delivered so that we can tailor the treatment to exactly the tumor and the surrounding normal tissue. So now we're delivering personalized precision care. So as I'm starting to learn more and more about this technology, I was like, yes, would love to be involved in doing the research, development, and clinical implementation of the cancer ablation therapy technologies. Again, as a curious mind, I'm thinking, okay, have the clinical experience, have the research knowledge, and we're going to implement these technologies. I need to learn more. What do I need to learn? Where are the gaps? We always say we're research informed or informed by the findings of various research studies. What's the gap? And I started to do my homework, going back to where my education started at Waterloo, and find the Masters of Health Evaluation program, advancing your career as a health professional. And I think, okay, so once we implement these state-of-the-art technologies, of course, we're going to have to evaluate the impact at the level of the patient, at the level of the health professional, myself, as well as at the health systems level. I don't have that knowledge yet, but through the Masters of Health Evaluation, I'll be able to arm myself with that knowledge to then be able to contribute to the team on that next step of understanding the value and benefit of implementing these technologies within the radiation therapy paradigm. So I apply and am truly grateful to be one of the first as part of early days. I'm a 2018 graduate, but I was a part-time student because I continued to work. So went through my career and my education journey in Masters of Health Evaluation. And there were multiple factors, because I'll also add at this point, working and delivering and bringing in 2 or 3, I should say, first in Canada treatment delivery systems, and a mother of 2 young boys. So Waterloo hit all the marks in terms of access to the education that I needed at the times that I needed, and it was like everything was falling into place. But of course, again, as a curious mind and a lifelong learner, I was like, how do I get more involved in the evaluation field? Because when I say evaluation in my hospital setting, they're like, yeah, we do evaluations. And I was like, okay, what are those evaluations? Well, we send out satisfaction surveys. And I was like, no, there's definitely more to evaluation than just satisfaction surveys. I need to learn what are those tools to be able to actually conduct effective program evaluations. So throughout my master's degree, I really sought out engagement with the professors. So a couple sliding door moments. I heard about the Canadian Evaluation Society's Educational Fund Student Case Competition. Very curious, what does this mean? So I sent an email to Dr. Kelly Skinner, who many of you might know, and said, do we send teams to the student case competition? And in fact, we did. So that year, as you can see from this picture, we were the first virtual team to compete in the student case competition at the Canadian Evaluation Society's conference. Incredible experience. So now you are in a conference with professional evaluators across the country, and you are delivering a presentation based on an evaluation proposal that you are doing for a variety of, or for one organization, but also engaging with a variety of organizations who are indeed looking for evaluation expertise. The other sliding door moment at Waterloo was I responded to an email to actually be a teaching assistant. And, you know, you wonder, okay, mom of 2 young boys, implementing 3 state-of-the-art cancer treatment delivery systems, participating in the student case competition. Do I pursue being a teaching assistant? Honest to goodness, the relationship that I was able to build with Dr. Kelly Skinner really to this day has been instrumental in understanding how to build capacity for evaluation in the hospital setting. So what does that look like today once I graduate from the University of Waterloo? I continue to find small bundles of funding to bring evaluation into a hospital setting and to build capacity across health professionals on what does program evaluation involved, and really the value of ensuring that we have prospectively planned for evaluation in all the services that we deliver. So as part of my student placement here at Sunnybrook, we were able to secure some funding to do a study measuring the impact of patient engagement from the perspective of health professionals leading quality improvement projects. And in fact, that study has now come to completion and will be presented at this year's Canadian Evaluation Society's conference. And furthermore, we continue to apply for small bundles of funding. One of them most recently was to define the requisite knowledge, skills, and best practices for MRI, so magnetic resonance imaging, in radiation therapy using a Delphi methodology. And that research in itself, again, leveraging a Delphi process as part of evaluation, and attached to us bringing in a first in Canada machine, the MR Linux, so combining those 2 technologies, has allowed us to move forward and change education, because those findings demonstrated that our current curriculums do not set us up for success. So we have been able to work with educational institutions to devise different continuing education or professional development programs to bridge the gap for practicing radiation therapists to be able to have the knowledge and skills to deliver safe and effective treatment on these new technologies. Another one that's really exciting, and I know Sarah is on the line here too, Sarah Souza. We are currently, as part of a research grant, evaluating the effectiveness of continuing professional development activities, whereby we're redesigning and validating the knowledge uptake and utilization tool, which is called the COOT for short. And this has been through continuing to engage with Dr. Kelly Skinner and the many graduate students that she has in her lab to continue that building of capacity, even post graduating from my master's. And other things that we continue to do is, again, at this year's Canadian Evaluation Society, we have a thematic breakfast. So building evaluation capacity beyond patient satisfaction surveys amongst healthcare professionals is one of the breakfasts that we'll be delivering at the conference, to really understand also from the evaluator's perspective, what is important, you know, fundamental knowledge that healthcare professionals should be armed with to be able to evaluate the many services that we provide to our patients, families, and caregivers. The other opportunity too that I sought out after being involved in the student case competition was I was able to meet members of the board for the Canadian Evaluation Society's Educational Fund. So through many conversations with the CESEF, I was able to sit on their board as their secretary to this day. So again, continuing to be able to diversify my network beyond radiation oncology, but now diving deeper into the evaluation field with many mentors in evaluation to be able to combine both areas of expertise to drive best practices forward within both fields. And as doing all of this, I continue to engage with multiple organizations that continue to align with my values and my purpose. So the Brain Tumor Foundation of Canada, the Windsor Regional Hospital, an organization called AO Spine, and Sunnybrook. And as more and more of these collaborations or requests to collaborate or provide services come on board or are getting more and more frequent, I learn to, still learning to this day, on how to build an evaluation consulting firm. So I am the founder of Determify Fundamental Strategy Group. And I think many people ask, what does Determify mean? And for me, the definition is to strongly commit to lead from purpose, live into one's values, and pursue new possibilities. And through the collaborations that we engage with in Determify, I continue to live through my passionate purpose, really to inspire and collectively create space with compassion for everyone to feel supported through their journey to Determify. So I want to stop there. And we, like Jen and I said, we'll provide you with my contact information, but we really wanted to dive deeper into some of the questions that all of you may have. So I'm going to hit stop share if that's okay, Jen.
Yeah, that was great. Such a wonderful story you just shared with us. Really taking us through your whole life journey, really, and how that continued to build on your purpose and everything. So thank you for sharing all that with us. I'd like to just take a moment to encourage those of you with us to turn your cameras on, and we can turn this into now a more of a group discussion and invite you to ask the questions that you have for Mikki. So please feel free to use the raise hand function, and I will call on people as they have questions. I know a lot of you had questions that were submitted in advance through 10,000 Coffees, but I would encourage you to find your question and ask it now in person to Mikki, so that everyone can hear your question and you can have that great conversation. So hopefully someone.
All questions are welcome.
Let me see if I can pull a question from what was submitted.
I have them in front too, Jen, so maybe between both of us we can find a few.
Like you answered a lot of these great questions already.
Sarah, I'm looking at the chat. I see, where did you find mentorship for your journey to starting your own consultant group? Yeah, still to this day is in the works. And I would say I have I'm gonna actually tell you a recent reach out. And I'll tell you a learning. So I'll tell you a learning and then a recent reach out to hopefully answer your question, Sarah. So at first, it was a lot of individuals knowing me and reaching out to see if I can provide consulting services, whether it be in research, evaluation, knowledge translation, which was great. And then I thought, I really am loving and getting excited working and collaborating with these organizations. And I want to start responding to RFPs. Responding to RFPs is a whole new game for me. So I thought, what other way to learn is to try and respond to one. So recently I responded to my first RFP whereby I didn't know the organization and did not have a contact there. So it was really one of those, first times. I was going to say another F word in front of that, but you all know what I mean. And I surprisingly received a call back to interview for the consulting role. Again, another first time. I said, I know how to interview for jobs that I'm going to work with the employee, but what does an interview look like for a consulting service? So I said, okay, you prepare, had the slides ready on how you would actually pursue doing the consulting services, and then delivered the interview, answered the questions, and the organization was great to say, loved everything, looking forward to collaborating with you. But as you look across, the firms that are out there, you don't have a presence. So we aren't able to Google you, see your work, see who you worked with before. So really that online presence and that brand building, I had not put a lot of time and effort into that. So that was a learning point for me, to which I really appreciated this organization saying, let's continue our talks, but while you kind of build your company. So then I started to, again, do a little bit of an environmental scan for other health professionals that also are attached to consulting firms. So recently, probably at the end of last year, sent an email to an individual who is attached to a large healthcare organization, but then also personally has their own consulting firm, and responded with questions about what was their journey, how can I learn, and received a response back, to which they are delivering 3 workshops coming in this next month on how they have identified their purpose, built their company, and now are expanding it. So I am currently enrolled in those 3 courses to continue my journey as a lifelong learner, and to also continue to build the presence of the consulting firm. So it's still a journey for me. And again, to answer your question a little bit more, Sarah, it has been to look to the field and see who's leading. Who's the thought leaders, and sending, whether I know the person or not, sending those emails to have the conversations, share my story and listen to their story so that I can learn and move forward. Does that help, Sarah? Again, it's more of answering your question with questions in my story, but I hope that's still a big journey for me ahead. And then Zola,
there's another question in the chat too.
How were you able to manage your time with working, completing your master's? Oh, I love this question already. Having a family and being a TA. So I'm currently a master's student and don't have half the responsibilities you had. So I think a lot about this myself too. And I'm going to tie it back to leading from the heart and from my passionate purpose. That's where I find my energy to engage in these activities. So everything that I engage with or collaborate with, for me, it's really meaningful to be tied to my values and my passionate purpose. And I think that's where I find the energy to be able to engage in these activities. So it very much is, I'm very highly reflector. So when I see emails come through or opportunities to come through, it's a moment for me to pause, go back to what it is, where I want to grow to, what I want to learn, who I want to be, who I want to collaborate with, all of those questions back to my values and passionate purpose. And then I will continue to move forward and seek out these opportunities. And I think one recent initiative that I didn't know I was going to pursue, but because of my very much value of family, I'm going to still remain vulnerable with all of you today, is that my husband and I were raising two sons, mixed race, and have had recent challenges with systemic racism in our schools. So again, reflecting on my values of compassion and inclusion and family, I have further started to seek out advocacy roles within our school boards to ensure that we are having statements and commitments and actions towards dismantling doing anti-racism work within our school boards. So again, continuing to draw on my values, but I think that's really what gives me the energy. I hope that helps. Please feel free to jump in and ask more questions though, like if you want to turn on your camera. Okay. I would also say too is that I do a lot of patient, family, and caregiver engagement through the research and quality improvement initiatives that I do. And that also gives me strong motivation, because when you hear their journey, it inspires you to want to impact meaningful change. So I find myself going back to those stories of the patients, caregivers, and families that we are serving within our hospitals to find that motivation to move forward with the initiatives as well.
So a question I just pulled out that was submitted was kind of goes along with what you were talking about. But someone asked, what aspect of your job do you like the most?
Yeah, it really comes down to ensuring access to state-of-the-art care for all cancer patients. And I find that through a variety of the initiatives. So it really, for me, connects back to the patients and their families, is the most meaningful, that I get excited about and want to continue to pursue. Again, I guess going back to leading from the heart and the purpose, there's definitely a theme with me, but not one that has been so eloquently stated throughout the years. It changes and I grow, and I've spent a lot of time writing it down, erasing it, saying it to people, and then going, oh, no, I got to say that a different way. Because it's almost like when you have those opportunities in the hallway conversations or at conferences or in your classrooms or in the groups that you are doing your group work with, it's having those moments to just share a bit at that right time to see if there's that connection to continue to learn more. So that has been also another continuing pursuit of mine, is to have that language about my goals and my purpose, to continue discussions and learn from the individuals that I'm working with too.
Great.
I see one. Oh, sorry, go ahead, Jen.
Yeah, no, I was just going to ask the group again if anyone is thinking, but go ahead, and if you have one you want to pick out and answer.
I see a few about connecting with Sunnybrook, working here and so forth. And I would say through me completing my clinical my health evaluation placement at Sunnybrook, I have been very intentional in speaking with many directors across the organization, whether it be the director of interprofessional education, director of interprofessional care, director of research, to demonstrate to them the value of the graduate students in health evaluation, health sciences, public health, health informatics at Waterloo. And I would say seek out, because many of them continue to, through Ashley King, I think I saw Ashley before, but I'm not sure if she's still online. Through Ashley, they continue to post placement opportunities across the organization, which then can expand and lead to more opportunities across Sunnybrook and beyond. So we've been very intentional in ensuring that we have postings for, I would say, if not every term, almost every term, to engage in a variety of different programs around the hospital, and virtual or in person. Not in person right now, but hopefully soon.
One of the questions was about, I think, the work culture at Sunnybrook. Can you tell us what it's like working there?
Yeah, it is. So if we look to the strategic plan, so I'm going to put my strategic planning hat back on because I work across many of the departments. We are advancing personalized precision care. We are supporting the integration of models of care across the system, ensuring and improving care experiences for our families, and developing high-performing teams that are changing treatment paradigms. So that's what you see in the strategic plan. And then you look across the organization, and the collaboration and the openness to have discussions about your personal and professional goals has been tremendous. So again, being ready to have that, to share your goals and your purpose across the organization has been, I've had many opportunities to do that. And again, why I probably have so many initiatives as part of my portfolio is because of that openness to join a team, join a committee that is working on things that align with your portfolio. And I would also draw back to those small pots of funding. Funding is not easy to come by in the academic world, but Sunnybrook has been very purposeful ensuring that there is funding or grant opportunities for allied health professionals and beyond. So I think being able to submit proposals for those type of granting opportunities also is unique to Sunnybrook and can expand your opportunities career-wise, because then once you receive that grant and you complete that research study, then you're actually presenting at a variety of conferences, which give you another opportunity to diversify your network and share your knowledge and expertise with a broader field. I'm looking at the questions too now, Jen.
I know, can you tell I was doing that? I'm like, oh no, get back to the unmute so I can talk and fill the space.
I think there's some interesting questions about the education required. So like Masters of Science versus public health and health evaluation. As you may have seen from my journey, I was even in managing of strategic planning initiatives at Pogo before even completing an undergrad at that point, because I was able to start within the organization as a volunteer, then move to summer student, then move to research assistant, and then from there. So I do think that determining your education, again, should align with where you want to go, where your goals are in terms of career, personal, and professional. But again, having a bit of grit to have those conversations to find the right role. I think if my colleagues were here with me, one thing that they would say is that I have not taken a traditional path. There's at this point not another radiation therapist that has done a degree in health evaluation, and have a consulting firm. And I think I quite like that unique path. So it takes some time, and I guess if you look to my consulting firm, Determify, there is definitely some determination in there to creating that path, to finding those mentors that will allow you to share your story and provide opportunities along the way that align with your goals. So align your education with what you're curious about. Ask the questions, what do you want to learn about? And where are the gaps in your field? And I think that's why I came across evaluation, because I was like, we continue to say evidence-informed, research-based, all of that, but we implement and we never go back to understand the impact or the outcomes. And that's what I thought, okay, there's a gap. How do I find the knowledge? Did the graduate degree. And now I'm bringing that knowledge back to radiation medicine. And as I think about next opportunities for education, yes, I do think about PhD, but that's me as a lifelong learner, not out of a necessity. And when I think about a PhD, I think about how do I find an intersection between cancer care, evaluation, and implementation science is really getting me excited now, because once with evaluation, now I want to actually understand the methodologies or science behind implementing, and then prospectively evaluating that implementation across. So really trying to find that intersectionality between the fields that I'm passionate about. But that is not based on a job requirement, but more so as a lifelong learner, and where I see gaps that I would love to fill with my knowledge to further, again, create better care experiences for our patients. We're a quiet bunch tonight. Please.
No, I was thinking that. But I love how much we like, it's very obvious that you're energized by the work that you do. And everything you just said there just still led me back to the answer you gave before, of like, how do you do it all? And just that when you find that thing that you're passionate about, that fuels your want to learn more, to do all the things, even when you already have a full plate, and adding more to it, because you're so energized by doing those things. So it's great.
Yeah, I would agree. Now, also, if I had my colleagues and probably my husband sitting beside me, the one thing that I continue to learn and try and do better is, where are those boundaries? And what somebody recently said to me was, you know that to-do list you have? Pair it or get rid of it with a to-be list. So make sure that you have that to-be list. And when you have those initiatives or opportunities come in front of you, take a moment, don't respond right away, but go back to that to-be list, and make sure that they align with further allowing you to advance towards achieving those goals of to be. And I thought, yeah, well, my to-do list is so long. Maybe I do need to figure out how to change that a bit, and work on the boundaries. So I guess I should say too, it's not a yes to everything. It's a yes with boundaries to ensure that you're learning something, you're contributing to something that you're passionate about. And that's a work in progress for me as well.
Mm-hmm. And I think allowing yourself the time to step away also, and recharge and fill the other buckets for other little people that you need to
absolutely
help fill their buckets as well.
Yeah, and I think in our household, we are a household that learns. So our dining room table is books. Mom, what are you reading today? This is what I'm reading today. And really staying on that, growth mindset, and really through curiosity. We ask a lot of questions. I ask a lot of questions each day, because another thing that was recently told to me, I think I was actually listening to a podcast, and it was, you're not here to be right all the time and have the solutions, but you're here to get it right. And I continue to remind myself that I don't have to walk into a meeting and have all the answers and know all the solutions, but if I can ask the right questions to figure out how to get it right, to lead us to the next step, that really is my goal, one of my approaches right now, I should say, in all the initiatives that we are moving forward.
That's great.
Dasha.
Hi, my name is Dasha. I'm currently a second-year student in the public health program. I'm on my co-op term right now, and I'm working as a social media assistant for the School of Public Health. I just wanted to thank you for taking the time to speak to us and giving us all your advice and telling us about your journey. I think something that really spoke to me was how you mentioned the power of sharing your goals. I think a lot of us know what we want and where we want to be, but without sharing any of that information with somebody else, it's difficult to find the right opportunities. So that gave me a lot to think about. I also wanted to take this opportunity to ask if those of you that are comfortable to please turn on your cameras so I can take a quick screenshot to share on our social media channels.
Yes, of course. So anyone who's open to being in a quick photo screen capture for Dasha, that would be great if you could turn your camera on, and then Dasha, you can count us down so we can all smile for you.
Yeah, okay. 3, 2, 1. I'll just take another one just in case. 3, 2, 1. Thank you.
Great, thank you.
Dasha, you really said an interesting point, and I think one that took me quite some time to also wrap my head around is how to get the courage. So it does take a little bit of courage to share your question, ask your questions, state your goals, share where you want to be, and it's taking me some time, but I completely agree with how you said it. It does provide an opportunity to have conversations that could lead, again, to a sliding door moment that you never would have had by the simplest conversation.
Yeah, and I think you never know what someone else has going on, and in your story, Mikki, like you never could have known that sitting down for coffee could have led to some of these opportunities that you've been given. And so, sharing these things when you're having conversations, you never know where that's going to lead, and who, was just talking to a friend who has an opportunity that might be a fit for you, or the power of the network, which I think people are always so afraid to do. Like, networking is like this scary word, but it doesn't have to be, and there can be so much value to taking the time to start building relationships with people. And this is my tiny little plug for what I do in my role for alumni relations, is that when you graduate, the alumni network is so huge, and it is this instant connection that you have to thousands of people. And, it's as simple as reaching out to someone on LinkedIn and saying, hey, I went to Waterloo and I wanted to connect with you for this reason, and I thought maybe we could have a chat. And it's just this instant opportunity for you and door opener to start conversations with people. And I promise you that Waterloo alumni are almost always welcome to that conversation. So.
Yeah, I think social media, I'm starting to, I think, try to do better with it, but so powerful. As I was briefly mentioning this program that through that Delphi study that I was mentioning has led to a program within the University of Toronto for practicing radiation therapists. Through sharing that program on social media, I am now being able to have, as the program director for that program, conversations with Australia, a country like Malta, Switzerland, because they're reaching out curious to learn more through being able to share some findings from a study that has led to developing a program and really understanding what the needs are globally. And they've just simply sent a message through LinkedIn or Twitter to have a conversation, and you jump on those conversations. And while they came on the conversation or on the Zoom or phone call to ask me questions, I also have learned so much by them asking me questions and understanding where their needs are, where their gaps in education and practice are. I also learned so much more. So it really is mutually beneficial to have those mentor, mentee, coach, peer-to-peer conversations, because you can learn so much through a simple tweet now. Who knew?
I know the information we can get on the internet. Yeah, so I mean, I'm just noticing the time. We're already just about at 5 o'clock. So if anyone has any last minute question they want to ask, I will give room for that opportunity. But I will just thank Mikki so much for being here and sharing such great information with the group tonight. It's been really great. I've loved hearing your story in even more detail today than I have in the past. So thank you for sharing that with us. And Mikki, if you want to put your contact information in the chat again, then anyone who wants to be able to connect or has more questions, I encourage you to connect with Mikki. You can also connect with her on 10,000 Coffees, which would have been the platform you signed up for this event through. Again, that's another great platform that you can use to search alumni. And these are also alumni they've signed up to be a part of our group within 10,000 Coffees. So they've already said they are open and willing to have conversations with students, with other alumni. So that is a great place to start if you're wanting to start reaching out to people and building your connections and networks. So check that out. You can search the member list by job type, just keywords. So it's a really great resource for you to use, and yeah, that's available to you. So let me just check my notes, make sure I've said all the things I want to say tonight. But
I don't
yes,
know
the last thing.
LinkedIn. Does anybody know? Anyways, I'm on LinkedIn on Mikki Campbell, just my name. But I don't know if there's like an @ in front of it. LinkedIn, I'm still learning.
No, I think
you're laughing at me. It's true though. I'm still learning.
Here, I can put your LinkedIn in the chat.
Okay.
It's just like your link.
Oh, okay.
To your profile. But yeah, so the only last thing I wanted to say was that you will get an email in your inbox for a quick survey about tonight's session. So please feel free to take the 30 seconds it takes to give us a smiley face rating on the scale, just to tell us what you thought of tonight. And
for you,
thank you for joining us.
Yeah, do the evaluation.
Please.
I always think about that now after graduating. I'm like, when these surveys come out, to stay true to my graduate work, I need to answer these surveys now.
Yes, complete all the evaluations. Yeah. I was going to say one last thing, and that's okay. Oh, it was just going to say, watch for, again, keep an eye out for our future alumni office hours sessions. And we also are doing a great panel for women's health around International Women's Day on March 10th. So there is information about that on the faculty event listing. Maybe Maddie, I don't know if you can quickly grab the link and throw it in the chat, but we're going to be talking about women's health and how to be resilient and build our healthy selves. So check that out if you're interested. It'll be a lunchtime kind of lecture conversation in a few weeks. But thank you again so much. Thanks everyone for joining, and have a wonderful evening.
Bye, everyone.
And thank you, Mikki.
No, thanks, everyone. Please connect if you want, if you have any questions.